Awesome. All right. Did they say what time you're gonna have the surgery?
No, they didn't say anything. Well, he said it about another hour, so I mean, it's been an hour, so I don't know.
Okay. All right. I'll follow up with them. Okay. So I just wanted to check on you, see how you're feeling, because when you come back, you're gonna be under the sedation. I'll see you when you come back, definitely. But I want to see how you were doing before.
Yeah.
And what else? So I just wanted to keep talk to you about dialysis in case we need it.
Yeah, yeah.
Did you ever have dialysis here in this hospital?
No, I don't think so. No.
Okay. All right. So I'm sure the surgery team talked with you
Yeah.
because sometimes after the surgery, kidney takes some time to
Wake up, yeah.
start working. Yeah, and sometimes we need to do like a treatment or a couple treatments of dialysis until the kidney wakes up.
Yeah.
Yeah. So I just wanted to make sure that would be okay with you if it happens.
Yeah, that's fine.
Okay. All right. So we need your consent. Already on the chart. Um, how long have you been on dialysis?
It's almost 8 years.
8 years. Wow. And what was the cause of your kidney damage?
Lupus.
Lupus.
Yes.
I see. And is it under control now?
Yeah, I mean, I have my days, of course. I have like joint pains and stuff, but I mean, they of course give me steroids.
Mm-hmm.
That's pretty much all that they can do about that. I do have a rheumatologist.
Uh-huh.
I have treatments that I normally do. It's called Rituxan.
Rituximab?
Yeah.
Yeah.
I started that, but something had happened. I got really sick, but they wasn't sure if that was the cause of me getting sick, or from the Rituxan.
How far? Like, what was the interval between feeling sick and getting the Rituximab?
I had got the Rituxan treatment because I had that treatment like it'll be the third time.
Mm-hmm.
I had got the treatment again. I started it again. Do you know you're supposed to do it like every 2 weeks and every a year or every 6?
Yes, 6 months.
So I had got the treatment and I got sick the next day, literally.
Next day.
But they wasn't sure if that.
Yeah.
But they said that there wasn't what caused me to get sick.
I don't think so. Because if it was, it should be right away.
Yeah, and I had already had treatment prior to that. It's just I had just got sick. It was just something that just happened.
It has to be something else.
Yeah, it is something. They ran tests. They did every test that they did. They couldn't find anything. I just got sick.
And that was for
dialysis.
Was the day? That's it.
Yeah, it was just that. Yeah, it was just that day I got sick. I went to the hospital, and they couldn't figure out but they said it wasn't from that particularly. My doctor, we ran tests. We did like the lupus panels and all the stuff like that. Everything was fine with that. So she just said it could have been just a bug that I had caught.
Yeah. How long ago was that?
Oh, that was a while ago.
Like more than a year?
No, that was
like a few months ago.
That was a few months ago.
Yeah. Well, around that time, there was a lot of people sick with the stomach virus.
Yeah. And they did COVID, they did the flu, they did everything to make sure that, and everything was negative. It was just a bug that I had probably caught that day after or something, but
and especially because your immunity is lower with the rituximab and all the lupus medications, so you're very sensitive to any minor infection.
Anything. I mean, it could have been me walking outside and somebody coughed and I just probably walked in it, or just anything could have happened. But
or you ate something from outside. Even if other people don't get sick from it, you're more sensitive. So do you agree to have blood transfusion if needed?
Yeah.
Okay. You initially say yes. And print your name and sign on the other side. And then the last page is these are the risks and the potential risks of hemodialysis.
Yeah.
Okay. All right. Do you have any questions?
No.
I understand. Well, you should be excited.
I'm
So,
both.
I'm gonna go see your nurse. I follow up with her, see when you're gonna be going, and we'll keep checking with the surgery team. And if you have any question or you need anything, let us know. Okay.
Thank you.
All right. Any questions?
I just wanted to know how long.
The surgery?
Yeah.
Well, it's very different. Very different between patients.
Yeah.
So the surgeon himself or herself cannot predict how long it will take.
Okay.
Okay. All right. Well, let us know if you need anything. Okay.
Thank you.
All right. You're
Thank
welcome.
That's where I want to be.
Really, Brandon? Wow.
You know I gotta record everything.